Hey everyone, my name is Alena and I was part of Group F. The country that I chose to profile was Turkmenistan. Before I jump into it, I just wanted to give a brief overview. If nobody knows where Turkmenistan is, it is located in the Central Asia area. Their capital is going to be Ashgabat, and their government is primarily ran by hereditary dictatorship. On this slide, you're going to see the overview of Turkmenistan. Their population total is going to be 7,364,438 people. Their population growth annually is about 1.8%. Their GDP per capita is 8,232.7, and their GDP annual growth is about 6.3%. Before moving on, I would like to note that Turkmenistan is considered to be upper middle income, so they rely heavily on production and export of natural gas, oil, petrochemicals, cotton, and wheat. 40% of the people who live in Turkmenistan are primarily farmland workers, and their age group is usually varying between the start of 15 and ending at 64 years of age. A little fun fact that I wanted to point out on this slide, and why I gave you that backstory is because the picture that you're seeing to the left is called the Gates of Hell. It has been continuously burning since the time of 1971. It's considered to be this massive fire crater that's about 160 miles north of Ashgabat, which is the capital that I had mentioned previously. It was actually accidentally created by the Soviet drilling rig. It had collapsed into the cavern full of natural gas, and in an attempt to decrease the spread of the poisonous gas, they decided to ignite it, assuming that it would eventually burn out in a couple weeks, but it's now just been burning ever since. People actually go to visit this location, even though Turkmenistan isn't known for a lot of tourism. This is one of the attractions that brings people from the outside in to come and, see their country, which does get to be a little hard sometimes considering how the government is there. But this is one of the highly visited attractions that they have in Turkmenistan, which I thought was kind of neat to share. This slide focuses on the demographic statistics of the area. The birth rate is going to be 21 per 1,000 people, and their fertility rate is going to be 2.6 births per women. The life expectancy at birth for females is 72 years of age, and the life expectancy at birth for males is 65 years of age. The death rate is going to be 7 deaths per every 100,000 people, and 67% of the people typically die by non-communicable diseases. The top causes of death and disability per every 100,000 people is going to be ischemic heart disease, stroke, HIV, and AIDS. Those are the top 3. And the risk factors are hypertension at 39%, tobacco use at 6.1%, alcohol consumption at 2.93%, and obesity at 21.4%. I would like to circle back and just note that the age group of the working class starts between 15 to 64 and ends at around 64 years of age. And if you look on this slide, you could see that that's where the tobacco use and the alcohol consumption usually starts. The individual that I chose to profile is a man named Arslan. He is a 50-year-old male who has primarily worked in the fields since the age of 15. He relies heavily on this work to provide for his family of 4. He does have a history of hypertension, smoking, and occasional drinking. The resources that Arslan has available to him are very little. Very sparse clean drinking water, which is questionable during the hotter days of the year, very limited access to healthcare, and little to no education regarding his health condition. The primary health challenges that Arslan will face will be his age, primarily being one of them. Because he is 50 years of age, it just unfortunately increases his risk for heart disease, stroke, diabetes, and respiratory diseases. His health history of hypertension increases his risk of heart disease and stroke. The occupation, considering that he's probably been in it since the age of 15, would be respiratory diseases, and him being a tobacco user and occasional drinker, it increases his risks for COPD, heart disease, stroke, cancer, and asthma. Some sustainable developmental goals I think we could look into is good health, decreased tobacco use, clean water and sanitation, good well-being, and just quality patient education. Considering that 40% of the people are probably in a more rural area of Turkmenistan, it could be hard to obtain the services listed because of the geographic isolation as well as the socioeconomic factors that they face. So good health and well-being is just relevant because of Arslan's case, the need for his hypertension management and tobacco use. In order for these to be achievable, I think you would need to have an improvement in just affordable healthcare in general, as well as just access to healthcare to obtain the quality patient education that he's needing, as well as trying to implement any kind of preventative care measures also. The clean water and sanitation is always important to help improve the area's water quality, to help decrease the hydration, especially in Arslan's situation due to the fact that he does have hypertension. Dehydration can increase those risks, and we wouldn't want that to worsen, especially being in the rural area that he is. So helping to create and improve the drinking water, it could just ensure that the community as a whole has clean drinking water, which can obviously reduce the risks of diseases and ensure that families and farmers are staying hydrated in the area. For the tobacco use, I think implementing support groups for tobacco addiction, and if the drinking ever gets more than just occasional and becomes to be excessive, I think implementing support groups for, alcoholism and things like that can help not only the individual become a more healthier state of mind and individual as a whole, but it could also create healthy habits for the community as well. I think Turkmenistan's healthcare system faces significant challenges that contribute to its overall lack of access to quality healthcare for its population. Several factors I think will always play a role in why the country struggles with healthcare delivery, but some ones that we could primarily focus in on is that Turkmenistan, there's a lot of rural urban disparities. You're either in the city or you're in the rural areas. There's no in between point for them, which in the rural areas, it just limits public health services in the underdeveloped areas. And there's a lack of preventative care on top of lack of quality patient education. I hope that in the future we could see the disparities between the rural and urban areas decrease, and they just become more developed and improve infrastructures and just enhance the overall quality of life in the rural areas and just really bridge that gap for them for their future.